When I was a little boy, I was used to go to the hospital for little sicknesses. I decided at that time to be a doctor. So it was my only choice to be a doctor. It was my first choice, my second choice. I just wanted to be a doctor. So that's all. I like to repair. I like to try to repair to make people happy. When we do a surgery, you see the result fast. You see how the patient get well fast, and I like it. I like it. I want to see my patient improve. If a patient comes with a complaint and at a little level of the surgery, I can do something for the patient, that is the best for me. If I've tried to be a surgeon by my own, maybe it would have been made very difficult for me to achieve my goals. Surg For All changed my life completely. And when I reached Valencia, they welcomed me with joy, with happiness. I was about tears. Dr. Junio, Dr. Casanova, they presented me to other doctors of Igbo, and all of them taught me something new about medicine, about life, about everything. So my family, my wife, my little boy, we are grateful. For me, it's a challenge. I have to be the doctor they want me to be. If I'm where I am now, it is because of Surg For All. And Surg For All changed the life of many people in my country. I remember a patient of 65 years old who for many years he was wearing urinary catheter, and he turned in many hospitals, and finally he reached in our hospital, and I was able to manage bleedings, and I was able to remove his prostate, and I discussed with the family after the surgery. It was a great moment because at that time I understood that what I've learned in Valencia, it was possible for me to do it in my country. And after some days, when I removed the urinary catheter, the patient was very happy, and I understood that I changed his life or saved his life. The most important, most different things I learned in Valencia was the endoscopy. If it is an open surgery, the patient will remain with the catheter for 5 or 7 days or more if the patient gets an infection or complication. But the advantage we have in the hospital when we have the endoscopic machine was that we do the surgery, and 2 or 3 days later, we remove the catheter of the patient, and the patient is able to go without the catheter and without the complaints. Having an endoscopy machine increase the number of patients coming to our hospital and increase the happiness of our patient. Many hospitals doesn't have endoscopy. So you see a patient moving more than 500 kilometers because they want to do the surgery by endoscopic devices. And it's a joy. It's a joy, and we are grateful to Surg For All because I'm sure that without Surg For All, it was impossible for us to have an endoscopic machine in our hospital. It is sometimes very difficult, but generally I try my best to achieve my dreams. Before Surg For All, I'm not sure that I could be able to do urologic surgery. So seeing how they work, see how they are supporting me, sending me messages to see how I'm feeling and encourage me. So I have to achieve all my dreams. And my dreams, it is see my patient getting well. Everything we are doing, everything I'm doing is try to help my patients. That's my motivation. Search For All, they pay for everything. They paid for my flight, they are paying for my school bills, for the housing. If I'm where I am now, it's all about Search For All. And thank you. Thank you. Thank you very much. Thank you to them. I don't have words. So thank you.